Hi, and welcome to Action Kidney Cancer's video on the difference between kidney cancer and kidney disease. Today, I'm delighted to be joined by urologist Steve Bromage from Stepping Hill Hospital in Stockport. Thanks for joining us, Steve. It's a really pleasure to have you with us today.
That's a pleasure. Nice to be here.
Lovely. So if we start with a nice simple question, Steve, what is the difference between kidney cancer and kidney disease, and how do you know if you've got one or the other?
So it's a common thing that comes up actually, and it's not unusual for me to see somebody in one of my clinics with a problem with kidney function, whereas in actual fact, I really deal with problems with kidneys and the anatomy like a kidney tumor. So it is a common problem. So the difference is that a kidney disease tends to refer to problem with the function of the kidney. Although you could say disease refers to any problem with the kidney, but what we really mean is about a function of the kidney. So the kidney is important because it filters the blood, gets rid of lots of toxins. And if the kidneys aren't working as well as they should, then people can have symptoms, or it can actually show up just on a blood test. In terms of kidney cancer, that's all about a growth in the kidney, a malignant growth. And although the perception is that a kidney cancer affects the function, an early kidney cancer does not usually affect the function of the kidney at all. It's like an expanding ball within the meat of the kidney. And the meat of the kidney that does the function actually works normally in most cases for quite a long time, even with a large tumor. So that's the main difference. The disease tends to refer to function, and a tumor refers to or a cancer refers to a growth in the kidney.
That's really good and really interesting to hear that difference. One thing we hear within our forums and when we talk to patients, and I'm sure you do too, is if you're removing one of my kidneys, is my kidney function therefore going to suffer from that? And if so, how is that monitored?
So you're absolutely right. It's a really important. This is a really important consideration. It's something that comes up all the time, and it's a big and important consideration for us. What the impact will be on removing some of the kidney, and it might be part of the kidney in a partial nephrectomy, and it could be the whole kidney. Inevitably, with surgery, no matter how good you are and what type of surgery you do, you will remove some kidney function. And that might be a very small amount in a part removal, partial nephrectomy, or it could be 50% of the kidney function in a full nephrectomy. Now, the impact of that depends on the underlying kidney function of a particular person and their risk factors for having kidney problems in the future. For example, if you have completely healthy kidneys, we know that people that donate kidneys in that situation, so they are losing a whole kidney, live completely normal lives with the same life expectancy as the normal population. However, if you're somebody that has diabetes, high blood pressure, even an older person has usually those people will have a problem with their kidney function already. You take away 50% of their kidney function, and they may then have problems. So it's really not a straightforward answer in terms of what impact it's going to have on a patient, because it depends on what they are like, as in what their medical problems are, what their baseline kidney function is like, how good the kidney that is left behind is, and what their risk factors for kidney problems are in the future. So you have to put all of that together to try and establish what drop in kidney function somebody's going to have.
Okay, so if you were to remove all or part of a kidney, how then would a patient's kidney function be measured? How would it be kept an eye on? Is it easy?
Yeah, so you can monitor it, and that's absolutely straightforward to do. One of the things that people will ask quite commonly is, will my other kidney grow or compensate? Unfortunately, the other kidney doesn't grow unless a kidney is taken out in childhood when it's already developing. So you don't get an increase in size of the other kidney, but it does take up a bit extra work than it normally does. Of course, it's coping with what previously was done by two kidneys. So you do see a little improvement in that side in terms of its function. But Usually your kidney function blood test, which is measured in GFR, will drop by around 50% if the kidneys are even and you're removing the entire kidney. Now, what this does quite commonly is that the GPs will see a drop of GFR, and they often don't put two and two together. They don't think, oh, this person's had their kidney removed and that's why. And they may contact a patient and say, I'm really worried your kidney function's dropped. You need to have more assessment, maybe referral to a kidney function specialist. Of course, that may not be necessary at all. It's an expected drop after surgery. And the monitoring is all about checking the blood tests. So depending on that baseline level will determine how frequently it needs checking. If it was fairly normal, even after a kidney removal, then it might only need doing once a year before a scan, for example. If it's abnormal, it might need doing more frequently, and it really does depend on that level. And then the other issue in terms of monitoring for function is blood pressure. So that's really key, because blood pressure is very integrally connected with the function of the kidney. A high blood pressure can cause kidneys to deteriorate, and a deteriorating kidney can cause a high blood pressure. So monitoring blood pressure is really important as well, and a home monitor is really useful for that.
So when you talk about GFR levels and kidney functions, when should somebody start to worry that they're heading towards kidney failure? What is there a score, a mark? When should somebody really start to seek help?
Yeah. And so this is where it becomes a bit confusing as well for patients, and particularly people that look on the internet, because a GFR with one kidney, a certain reading with one kidney, tends to be a health. You know, if you say let's take a reading of 20, a GFR of 20 with one kidney suggests a better kidney and a more healthy patient than a GFR of 20 with two kidneys. And that's because if you remove one kidney of somebody that has a level of 40, they're going to be left with 20. So that kidney on its own is not that bad. So first thing to say is, with a single kidney, your GFR reading is probably not as bad as you might be worried about. However, it does need monitoring, and medications often have to be adjusted when your GFR gets below 30. So post a kidney removal, if the GFR is getting to below 30, then it's worth having medications looked at by the GP, because they may need to be altered. And then when it gets down to, 15, then we're really starting to worry that could this be heading towards something like dialysis. But in terms of a referral to a kidney function specialist, a nephrologist, generally I refer people where their GFR has dropped to below 30. But if it's a sort of quite rapid decline, after taking a kidney out, maybe it's dropped to 50, and then I can see it's dropping every time I see them, then I might refer them a bit sooner. But generally, I refer when it drops below 30. That's my rule of thumb.
So just finally, really, as a kidney cancer patient who's had their kidney fully or partially removed, what can they do to ensure their kidney function remains high enough to not run into problems?
And it's a really common question. I think a lot of people with kidney cancer, knowing they're going to have kidney surgery, immediately assume that they need to be on a special renal diet afterwards. In actual fact, the majority of people that have kidney surgery have kidney function that is okay, that does not need any special dietary changes whatsoever. I mean, of course, it's really important to have a healthy diet and not adding excess salt and sugar into foods, and not eating too much animal protein are probably all good things for your kidneys. Maintaining a good fluid intake is really important as well. So, sometimes people can overdo it, surprisingly, but most people don't drink enough. On average, most people need at least 1.5 litres of fluid a day, but probably 2 litres is a good value to look at, and that's all fluids. If it's hotter or you're exercising, you probably need a bit more fluid. If the urine is ever dark, you're not drinking enough. That's a real sign that things are, you're not getting enough fluid in. So fluid input's really important. Diet is you rarely need to go on a sort of potassium load diet. That's something that people worry about, but that's really only in those cases of very, very poor renal function. And it's more about just a healthy, balanced diet.
Perfect. I think that's some really helpful information, Steve. And on behalf of the charity and everybody watching the video today, I really thank you for your time.
No, it's a pleasure. I guess the only thing I would add, because I didn't mention alcohol, and it's a really common question I get. People are worried, they've had a kidney operation, they need to look after their kidneys. Can they have a drink? And yes, they can. I mean, it's about moderation. Certainly, a small amount of alcohol will not harm a single kidney, even if the GFR is towards the low side. But it's being careful. It's not excessive. Just a small amount would be fine.
I guess that's the take-home message from what I've heard from you today is diet, drink, just do what you would normally do, really, and don't be silly.
Yeah, and monitor blood pressure. It's always
monitor
good.
Blood pressure, yeah. Lovely. Thank you for your time today, Steve.
It's a pleasure. Nice to speak to you, Steve.